Welcome to the AUA News Inside Track podcast. Today's Inside Track podcast is part of the QIPS Insights series, which is brought to you by the Quality Improvement and Patient Safety Committee. We'll hear from leads of quality improvement and patient safety projects, exploring how they got started, what worked, and key lessons learned.
Hello, I'm Gregory Auffenberg. I'm the chair of the AUA's Quality Improvement and Patient Safety Committee. I'm a urologist in St. Louis, Missouri, a urologic oncologist in my practice, and I'm very excited to join you all today and be joined by a good friend and colleague, Dr. Andrew Harris, who is actually the soon to succeed me incoming chair-elect of the Quality Improvement and Patient Safety Committee for the AUA, as well as a staff urologist at the University of Kentucky and the Lexington, Kentucky VA. We both share a lot of excitement about what we're going to be talking about, and that is shared by the AUA as well as our committee members. Is we record this podcast to introduce a new concept that we're bringing to AUA membership called the QIPS Quality Improvement and Patient Safety Insights podcast series, which is a series of podcasts that we hope to record over the next coming months or years to bring to the AUA members exactly what the title says, some insights and learned experiences along the lines of quality improvement and patient safety issues, and hopefully have this be an exciting new podcast opportunity for people to learn and share ways to improve their own practice. So, by way of that introduction, just wanted to say that the topic itself is something that we see, we'll dive into real world patient safety and quality improvement projects. This could range from large scale system wide initiatives to smaller practice level projects, that will make a real difference. We'll be talking to project leaders behind these efforts, learning how they got started, what worked, the lessons they learned along the way, and maybe even what didn't work and what they would recommend against repeating. Whether you're curious about how to kick off such projects in your own setting or you're interested in how others are improving their care setting, this podcast series is for you. So without further ado, I'm excited to dive into our first episode, which is going to be a conversation between myself and Dr. Harris about his career in quality improvement and patient safety as it pertains to urologic care and both what he has done in the past and what he sees as important ways to make an impact both currently and going forward, and also get a bit of his take on why he sees this podcast series as such an important avenue to spread good word about quality improvement and patient safety. So without further ado, Dr. Harris, welcome, and thank you very much for joining us today.
And thanks, Dr. Auffenberg. I appreciate the opportunity and appreciate the opportunity coming up to serve the Quality Improvement and Patient Safety Committee, and looking forward to talking with you more about this exciting series today.
Great. Well, I think as a first question, maybe if you could just tell our audience members a little bit about your path into healthcare quality work, why you've sort of made that such an important focus of your career, and why you see it as so important.
Yeah, I appreciate the question. And the more that I have the opportunity and the pleasure to work with people, the better I understand how we're all so different based on our past experiences and how we all think different. That's one aspect of quality that I really, really appreciate. And so my story starts about when I was 8 years old. We moved to Georgetown, Kentucky when the Toyota plant opened. My father got recruited to be the plant manager, and that's how we got there. And that will become relevant on my journey to quality later. So ended up going to University of Kentucky Medical School. I ended up training at the Hospital University of Pennsylvania. And then after finishing at Penn, went into private practice. And it was during this time, I had a patient in stirrups who was here for a ureteroscopy, had a scope up looking at the kidney stone. I asked for the laser fiber, and they said there's no laser fibers in the hospital. Like, well, that's inconvenient. And they had to run to a neighboring hospital to get the laser fiber. They got it very quickly, small town. We were able to treat the patient with good results and those things. But I had the typical, old school surgeon response when I came out: who needs to be fired? And then, that's when I called my dad, who obviously is an expert in lean methodology, given his experience at Toyota. And he started asking me all these different questions of, How do you know how many you have? How do you know when you need to reorder? How many are they supposed to have? How do you track them? How do you deliver them? And it was just a lot of questions about the system that I'd never thought about. Like I thought that I was sort of the center of the system as the surgeon delivering the care instead of a piece of the system. And so that was very enlightening to me. And that led to me coming back to do a fellowship at the University of Kentucky. I did it in robotics and endourology. But during that time, I actually got a graduate certificate in improving healthcare value with emphasis in improving uh, uh, patient safety and quality improvement. So I really just fell in love with the science. And that ended up leading me to staying here at the VA hospital and actually going on to get an MBA from there. And so that's a little bit of my story and how I got interested in quality. It's just such an interesting take on how things happen sometimes. And then, you know what? I think that's really interesting. And so I'm going to run down that route. And then that ended up being an MBA degree and actually a position now where I work a lot in quality on most days, have the opportunity to work at a high level on both the VA and at the University of Kentucky and influencing processes and outcomes. And it really is a joy and an opportunity to work in that environment.
Really interesting. So, I mean, I think it's fascinating to see how sort of a huge component of your career starts with such a single anecdote. And I think it's really inspiring to hear, how that has really taken you into an arena where you felt compelled to take not just one, but many steps into making, solidifying this as a huge focus of your career. I think as you think about that journey and you think about our audience members who, I think the focus on healthcare quality and training and most people's day-to-day practice is probably not at least a concept that is unfamiliar any longer. But I would say both in my experience and I think yours as well, I've heard from plenty of people sort of sure people say stuff to me all the time about caring about healthcare quality. I think ostensibly all of us at the heart of our sort of practice and ethos ultimately have some desire to see things go well, and so could have at least a nascent interest in the quality of what we do being high. But how do you take some of those things, and you've obviously talked a lot about your journey, but I guess what would you sort of speak to other audience members is, you know, easy first steps you would sort of either you took or you've seen others take to kind of making sort of a background interest in healthcare quality, something that you're a little more seriously involved in. How would you engage that, and how would you sort of see that journey towards more serious quality improvement work in your day to day or week to week practice environment, something that a person could make part of what they do? What would you kind of talk about or recommend there?
Yeah, I appreciate your question. And for me, when I started, it was not in a titled position. It was not in a time protected position. It was just a genuine interest in trying to make things better. And this was before any of the degrees and those things. And so for those people who find it interesting or who want to be involved in either better understanding the quality that they provide or improving the quality of the work around them or the functional flow of the work around them is to get involved. Surgeons by nature and urologists are so uniquely positioned to influence the health system because of how we interact with the system. As surgeons, we touch almost every part of the care continuum, right? We touch the clinic part. We do the kind of chronic care or the ambulatory care. We do acute care. We see the ER. We see inpatients. We see the OR. We understand the rehab and how that flows when we have to send patients there. And so we are innately influential in the system by the position we carry. And whether you wanted to be a leader or not, you got it. Like when you became a urologist, people look to you to make things different and try to make things better. And you wield a lot of influence. And if you choose to use that influence in a way to make things better around you, you can really make some change. And so what I would encourage people to do is you don't have to go take a bunch of classes in the beginning. The QIPS committee, as you know, we're getting ready to release a project guide. Here's QI 101. Here's how to do some things. And really just get involved. Most of us work with a team. We work with nurses, we work with medical assistants, we work with front desk people, we work with OR staff people, scrub techs, OR nurses, you name it. Choose an area where you think you want to make things better. Put those people together, lead that team, and see what you can do. right? You find passionate people, you find a problem people think needs to be fixed, you'll be surprised at how much buy-in you can get in trying to move that thing forward. I would be careful about, trying to go against something that is system-wide in the beginning, work in your locus of control to try to influence some change. But it's just do it. If you want to get involved, just try to do something and make it better, something that you believe needs to be changed, and go after it. And you'll be surprised at how much difference you can make. And that's what really launched the love of quality for me. And I realized not everybody is going to go get degrees and get multiple lean certifications and those things, and that's okay. But just being able to influence change in my local environment was intensely rewarded. And that was because I just took a step and said, hey, can we try to make something better? This seems like a problem for me. What do you all think? Can we work together to make it better? And so for those of you who are interested, that's a good way to start. For those of you who are interested in better understanding quality, I think, getting a little bit of education in healthcare value makes a lot of sense. Healthcare value is an equation of outcomes and experience over cost. And I've never met a urologist who thinks they deliver bad care, right? Yet if you look at benchmarking, there are percentiles of where people live. And so if you want to understand it, it may not be your outcomes, maybe it's your cost. And maybe there's ways you can influence that. Or maybe it is outcomes, and maybe it's length of stay or readmission rates, and maybe there's ways you can influence that. But you can only do those things if you have the knowledge of where you can work. And so if you don't understand where you live and some of your outcome rates, well, let's see if you can find that information. And knowledge is power. And that gives you an opportunity to say, okay, we're sitting at the 50th percentile of readmission rates or return visits to the ER rates. Let's see what we can do to start focusing on this as a group and together. And that's the first step. So those are two different ways. You see processes that are challenging in your environment. That's one way to tackle them. Get involved. If you want to understand where your outcomes and where your quality is, knowledge is power, and it gives you a target to go after. So those are two different ways, depending on how you might see quality, that you can get involved tomorrow.
Great. I think it's many valuable insights there, and that's wonderful. I think as you, look a little bit at what you'd say to a person who's maybe kind of starting to set their toe in the water, or kind of in the early part of a quality improvement initiative. Maybe speak a little bit to I think obviously the tangible goal of a quality improvement project is to hopefully add and improve upon some issue that is pragmatically being faced. But beyond that, sort of, can you talk a little bit about your feelings and some of the quality improvement you work in both not just the specific project goals, but to you in your career, to as a health system as a whole? What would you say some of this work has added both by way of sort of career satisfaction and or sort of value to a larger system, that may not be measured in a single project as sort of a way that, I've heard you talk about many a times as been a real driver behind some of the work that you do?
Yeah, I appreciate your question. Being able to work with teams and influence change for me is incredibly fulfilling. And taking some time to better understand the science behind quality improvement methodology, to better understand the culture you need to move things in the right direction has been very worthwhile for me to have a better sense of purpose in what I do every day. And so it's almost like a burnout mitigator for me to be able to see these changes. And I'll give you an example. We're working on turnover time at the university at the moment. When we started this work, the institutional turnover time in this particular service was 56 minutes. And that's very long, as most people know. And we're currently in the mid-30s, right? Everybody's happy, right? Everybody loves it. Patients are getting to eat sooner. We're getting to more inpatients on the floor, getting them home sooner. The staff, they have a bit more sense of a purpose in the OR. The attendings all love it. We're being better stewards of our time in the operating room. I mean, it's a huge win for everybody, and everybody's happy. And for me, that's a huge driving force. And I think one of the things that I have better understood about culture and trying to make things better is that we are lucky to get to do what we do every day. I forget that sometimes. There were people who wanted to get into med school that didn't, and I did, right? I don't ever want to take that for granted. And there are people who wanted to get into urology, and they didn't. but I did. And I don't want to take that for granted. Yeah, I worked hard, and yeah, I had a couple of the balls bounce my way, but that could have easily been somebody else and not me, right? And so that has really helped me focus on looking at the system of a way to make things better. Because you know what, Dr. Auffenberg, nobody else shows up hoping for bad outcomes, right? I am lucky. I want to work on people. I want them to have great outcomes. So does everybody else. Most people are in those jobs that other people could have had too, but they don't. These people were able to have them. And so they want the best outcomes for the patient. I want the best outcomes for the patient. And so that helps me see the system for what it is instead of being sabotaged by someone, right? We've all heard that, right? In residency, that was a common saying, I've been sabotaged by so-and-so. Nobody does that. That's not a real thing. I mean, most people are not malicious, right? So that has really helped me see an opportunity instead of a problem. And that's driving for me. And being able to do these things at a higher level to make change, to make patients' lives better, to make employees' lives better, mitigate burnout, have people excited to come to work, for me is incredibly fulfilling. And I feel very fortunate that I'm in an opportunity to do that on a daily basis.
Great. Really, really great. And I guess a follow up to that, I mean, you can just feel your passion for what you do and why it's so important. Much of what you said resonates a lot with me too, and why I do this work. I guess as we get to, a little bit of a conversation about what we're doing here as the KIPS committee and this KIPS Insights podcast series, maybe a quick bit on how you see this as an extension of that work or potentially even a new avenue to continue some of that work. Tell me a little bit about your thoughts about this podcast series and why you're so excited about it.
Yeah, I appreciate the opportunity to even be involved in such a podcast, and I'm so looking forward to the knowledge that we can spread across the listeners of the podcast. And what we hope to capture is finding areas in quality where people have a passion, where you can hear it, like you were just saying, right? Let them come and have an opportunity to talk about what they have done, what they've gotten out of it, what the patients have gotten out of it, what people who work around them have gotten out of it. And I'm really excited to hear what other people are doing and how they're enacting change and using their position as a urologist and a surgeon leader to make things better for everybody around them. And I'm really hoping we can capture a large continuum of projects that are done in a single clinic by a single physician, all the way up to those urologists that are in positions to influence change across multi-state systems. And what is that doing for people? And those are vastly different projects that require vastly different teams, but I hope we capture that entire breadth. So those people who want to start tomorrow and don't have much of a background, but they want to, and they think they may be similarly passionate about some of these items we may talk about, such as your staff getting breaks at lunch, such as your ER having an algorithm for stones, right? That they may have some courage and get some knowledge. I can do this. I'm going to go do it tomorrow, right? But then also those of us who are moving along in careers and figuring out a way that try to be influential in the system and find that next step and how do we make things better at a larger scale, hearing about those too, and how we can take those arguments in those cases to leaders that which we meet with, to be like, hey, this is going on in the country. Are we aware of that in our place? And how do we do that? So I think that's what I'm so excited about. I'm excited to find people who are passionate about making positive change from a quality and a patient safety perspective across the entire continuum, from individual level to even multi-state or national level improvements. So,
couldn't have said it better myself. Well, in that context, it's been really fun talking with you, Andrew. Obviously, we've had many conversations before. I can't wait to see where this series goes. I think it's going to add a ton of value to the urologic community and the quality improvement community at large. And, I think to our listeners, I hope you're excited about this, and I hope you stay tuned for future episodes, which will be largely designed around having Dr. Harris basically speak to leaders in quality improvement projects from across the country, and really more than just an interview about what they kind of their foundation and their background, is actually getting into the weeds on some specific projects to give the listeners some insights in more of a kind of case-based scenario to learn from. Here is a problem this quality leader faced in their environment. Here's how they work to understand it, and here's what they did to improve. So I think there's going to be a lot of quick things to learn and look forward to it. So to all of our listeners, we hope you're excited for this too, and please stay tuned for future episodes to come.
This has been QIPS Insights, an AUA News Inside Track podcast brought to you by the Quality Improvement and Patient Safety Committee. For more information about AUA's quality improvement and patient safety efforts, visit auanet.org/quality.